learned, you guys, you have a great facility here in Quincy. A facility that I'm familiar with from my own district, because medical facilities like Blessing, they are all across the landscape of my current district. And I wanted to come here and meet all the folks that are running this facility, get a chance to talk to the men and women who work here, and also talk about making sure that we have enough nurses and enough medical professionals to continue to staff up the areas that are in need, our orthopedic surgeons, our heart surgeons, our nurses and LPNs. How do we get them from school into training and into Blessing?
And what sorts of things can you work on in Congress to help make that process a little easier?
Remember, healthcare has a federal nexus. We run the Medicare program. We run the Medicaid program. This federal nexus means that I've got to find out what issues are happening in places like Blessing here in Quincy and ensure that I make changes in Washington, D.C. to make sure that the doctor-patient process and doctor-patient access is the #1 priority out of our processes in Washington. Yeah, we're all for lowering the price of insulin. As a matter of fact, the Trump administration, through their own regulatory regime, lowered the price of insulin. We got to do better. The problem is the solution that Democrats put forward in Washington would have limited the number of cures that we need to invest in to possibly cure type 1 diabetes for future generations. And that needs to be the focus. The Democrats are all about putting forth what they call solutions that are no more than gimmicks. And when they take away future cures and the ability to actually find future cures for any disease, not just diabetes, I'm going to be against it until we can put a package together like the ones that I've supported that are going to not limit cures but still address the situation at hand.
And with Blessing being such a good regional hospital for the area, how kind of critical is its success in your new 35 county district?
You know, this is a very critical hospital. Quincy and Blessing are the hub for getting access to the entire spectrum of healthcare right here in Western Illinois, and even for the tri-state area. But it's not much different than the areas that I serve in the current 13th district. My district in central and southwestern Illinois is dotted with many healthcare facilities larger than this and smaller than this. And just like with Quincy, many of my hospitals are the largest employers in our communities. And we need to have access to those doctors, access to professionals, and access to the care that we all expect here in the United States of America.
Why shouldn't Medicare be allowed to negotiate prices?
Well, when you talk about Medicare negotiating prices, do we ever think the federal government is usually the best barometer of making things more accessible and more cost effective? Well, let's make sure that we have programs that exist that get government out of the way. One of our best successes at the federal level has been Medicare Part D. We've seen premiums go down the last few years. That means cost for prescriptions overall for those who are using the most prescriptions at the Medicare age group have actually gone down. Let's not limit what we've seen as success with that public-private partnership that we see with Medicare Part D.